graduated from school, and even before that, when I worked in veterinary offices, I was trained on animal restraint and also how to perform examinations, treat animals safely, primarily so that the handlers stayed safe. Now with fear-free and low-stress handling, it looks more at the emotional health of that patient. Like, how can we not only keep ourselves safe, but how can we look at keeping them emotionally safe?
What does it mean for a pet's visit that your clinic is fear-free? The best way to think about it is it's reducing the fear, anxiety, and stress for the pet during the visit.
Hi guys, hi. You can come on in.
Our lobby isn't a waiting room. If a client comes into our building, our goal is that they're in their exam room probably within 15 seconds.
We're gonna get right in that room there.
There is no waiting out in the lobby. The pets don't cross each other. The pets are separated so that a fearful pet isn't stirred, those fears, those emotions aren't stirred up by meeting other pets, by sitting, if it's a cat, having to sit in the lobby while dogs bark at them.
So I will just go over a care plan with you, and we'll talk about any concerns you have.
Okay.
And see what all we want to do today.
You go straight into a room where the doctor and team can take care of the pet with the client in the room.
I haven't had a puppy in over a decade,
Okay.
so everything is a concern to me right now.
I gotcha.
I'm nervous.
Hi, darling.
You know, we do think about our pets, and most of our clients think about their pets as family members. Like, if I take my child to the doctor's office, I'm more concerned about how my child is feeling and that they stay safe, that they don't become traumatized, that they stay emotionally safe, and I'm there to protect them. And I think that that's how our pet parents feel too, is they care about the emotional well-being of their pets.
She may be a touch small for it. We may have to think of another option. I'll see if we have the sample that's the 2 to 5 pounds. So let's see if we can get her weight today.
Good luck.
So today we saw Abigail, the pug, and this was her first puppy visit. It was just about making her comfortable in the room, letting her run around and explore on her own, which she did. From there, it was just positively reinforcing her for any interactions with us by treats or praise.
Touch a little toesy, yay! Touch a little toesy, yes! I'm gonna touch this toe, yay! Just little simple things like that can really make a big difference.
We don't have to take the pet out and then bring it back in these transfers.
I'm going to give this to you. This is this morning's
Absolutely.
stool sample.
Thank you very much.
You know, she's 9 weeks old, so I need to get the whipped cream in there to get her weight. And I need to see if we have the size that we're gonna need, because we're gonna need the little one. After that, it was just allowing her to feel comfortable moving around the room with us while Dr. Shirley talked to the client.
Hi.
How are you?
Good.
Good morning.
Good morning.
Oh, you got your puppy. Hi.
Oh my goodness.
That's precious.
Inside the room, you'll notice things like non-slip mats to allow the pet more stability, more comfort on the table so that they're not slipping and sliding on a stainless steel tray that's uncomfortable and scary.
Let's get her up here on the table, maybe.
Okay.
Just because she's so small.
Off the floor.
So we'll try not to give her a whole lot of treats. Don't give her a sick tummy, but save that for her injections, yeah. See that? Yes. I want to just taste everything. She's exploring everything, isn't she? Which is also a very good sign of a healthy, emotional emotionally healthy puppy is that she's, eager to explore and interested and not fearful. So she's doing good. So this puppy is going to get a microchip today. And so it's a larger needle. And so we are going to use some lidocaine cream on the skin superficially. Just helps to make that less painful for the pup. And she's got that little thing of lidocaine cream on there. So what we're going to do is just insert it right in between the shoulder blades. She's going to be a tough little cookie, I bet. Look at that. She didn't even cry.
She's too busy eating.
She's like, I'm too busy. All right, and then we'll scan. Perfect.
Distemper?
Yep. All right. So left shoulder on this one. That's it. So she might be a little tender there later, but she took it like a champ.
At every exam, in every appointment, they're giving lots of treats. They're giving treats throughout to reward the pet for behavior that we are looking for in order to do the exam. Behavior that reward the pet for the injection, reward the pet for sitting and look in the ear, to let them know that this is not scary. This can be a positive place.
I don't think there's any veterinary practice or a veterinary professional that feels like they don't want to be fear-free. And it's more than just, I think it's a misconception that it's just about giving treats, but it's more about recognizing behavior, animal behavior, and these subtle signals that they get, that they give us and how they communicate, whether it's the position of their tail, their body language, and even just panting, yawning, sniffing the ground. There's some really subtle things that help us stage. And I think the big difference with us being fear-free certified is we are measuring FAS levels. And so if you're not measuring it, you're not always recognizing it. And we're still learning. Every patient is different, and every patient responds differently to the interventions that we may have. What works for one pet may not work for another, but we always work with that individual pet. Sometimes it means rescheduling and then coming back later on medication. Sometimes it means full sedation. Sometimes it means just changing what we're doing in the moment. And so we do use a lot of treats, but we use a lot of other things, like we change how we use our body language, not making eye contact with the pet, getting down on their level. We often will use things just to protect the pet and us and our safety. Thank you, Dr. Sherrill. You're welcome. You have a wonderful rest of your day.
Thank you.
Good to meet you. Yeah. Hi, Abigail. You stay out of trouble.
Thank you.
Bye.
Well, you sure picked a cute one. Well, she's all set. And if you guys have any other questions or anything like that, you're welcome to text us on Pet Desk or give us a call.
Perfect.
All right.